Fungal infections in cats are relatively common and can be caused by various types of fungi. The most common fungal infections in cats are ringworm, dermatophytosis, histoplasmosis, blastomycosis, and cryptococcosis. Ringworm. This is a highly contagious fungal infection that affects the skin, hair, and nails. It is caused by dermatophytes, which are fungi that live on the skin and hair of infected animals. Treatment typically involves topical or oral antifungal medications. Histoplasmosis. This fungal infection is caused by the Histoplasma capsulatum fungus, which is found in soil and bird droppings. It can be transmitted to cats through inhalation or ingestion of contaminated material. Treatment typically involves oral antifungal medications. Blastomycosis. This fungal infection is caused by the Blastomyces dermatitidis fungus, which is found in soil and decaying organic matter. It can be transmitted to cats through inhalation or ingestion of contaminated material. Treatment typically involves oral antifungal medications. Cryptococcosis. This fungal infection is caused by the Cryptococcus neoformans fungus, which is found in soil and bird droppings. It can be transmitted to cats through inhalation or ingestion of contaminated material. Treatment typically involves oral antifungal medications. Treatment for fungal infections in cats typically involves antifungal medications, which may be administered orally or topically depending on the type and severity of the infection. In some cases, surgery may be necessary to remove infected tissue. It is important to follow your veterinarian's instructions regarding treatment and to monitor your cat closely for any signs of improvement or worsening. In addition to medication, it is also important to maintain good hygiene practices to prevent the spread of fungal infections. This includes regular grooming and cleaning of your cat's environment, such as litter boxes and bedding. If your cat has a fungal infection, it is also important to isolate them from other animals to prevent the spread of the infection. It is important to note that some fungal infections in cats can be zoonotic, meaning they can be transmitted to humans. Therefore, it is important to take precautions when handling your cat and to wear gloves and protective clothing when necessary. If you suspect that your cat has a fungal infection, it is important to consult with a veterinarian for diagnosis and treatment. Fungal infections can be difficult to diagnose and may require specialized testing such as skin scrapings or fungal cultures. With proper diagnosis and treatment, most fungal infections in cats can be successfully treated and managed. It is also important to note that some cats may be more susceptible to fungal infections than others. Factors that can increase a cat's risk of developing a fungal infection include a weakened immune system, underlying medical conditions, exposure to contaminated environments, and stress. Prevention is key when it comes to fungal infections in cats. Keeping your cat's environment clean and dry can help to prevent the growth and spread of fungal spores. Avoiding contact with contaminated soil, bird droppings, and other potentially contaminated materials can also reduce the risk of infection. Regular veterinary checkups can also help to identify any underlying medical conditions that may increase your cat's risk of developing a fungal infection. If your cat does develop a fungal infection, it is important to follow your veterinarian's treatment plan and to monitor your cat closely for any signs of improvement or worsening. In summary, fungal infections in cats can be caused by various types of fungi and can be difficult to diagnose and treat. However, with proper diagnosis, treatment, and prevention measures, most fungal infections in cats can be successfully managed. If you suspect that your cat may have a fungal infection, it is important to consult with a veterinarian for diagnosis and treatment.